Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, and today I'm talking about my blog article talking about laser therapy and how we use that in the clinic. And I'm just kind of putting the final touches on our webinar I'll be doing this coming Thursday at 7 p.m. It's part of the Dinner with the Doctor series, and I'll be talking about laser therapy and how we use it in the clinic for soft tissues and joint injuries. So a laser is a concentrated light that goes into the body to heal the tissues. So in this blog article, I wrote about how laser helps with pain reduction, accelerated tissue repair, improved circulation. So those are some of the major benefits of laser. But I also talk about how the laser works and some of the conditions that we use it for. I'm going to switch over to the website if you're with me here on YouTube or on social media. And here's the company we use called Theralase. And Theralase manufactures the equipment that we can use for different types of conditions. Like on this chart right here, it shows migraines, carpal tunnel, neck pain, shoulder pain, tennis and golfer's elbow, rotator cuff tears, bursitis, low back pain, knee pain, Achilles tendonitis, neuropathies, ankle sprains, and plantar fasciitis, just to name a few. So over 100 different conditions are treatable with laser. And I'm getting really good results here in the clinic with the laser treatments that I'm doing on some of those conditions. Like last week, I was treating rotator cuff, some neck pain, elbow, a tennis elbow, plantar fasciitis or pain in the foot. So those are some of the conditions that I was treating. I treated knee, arthritis in the knee. So those are some of the conditions I treated last week. Now, how does it work? Well, I'm just going to go over this right from their website at Theralase. Cool laser therapy heals tissues and ailments by injecting billions of photons of invisible and visible light into the tissue structures. These tissue structures naturally contain protein strands called chromophores and cytochromes located in the mitochondria of the cell, known as the cell engine or the powerhouse, which have a unique ability to absorb laser light energy and transform it into chemical energy for the cell. That's pretty cool. And this chemical energy is utilized by the tissue to significantly accelerate the healing process and reduce pain in the body naturally. So that's pretty awesome. And we already went over some of the conditions, and they talk about the clinical studies for those conditions here, what the scientific documentation is for lasers. So it's well proven, lots of scientific studies. The next question here in the frequently asked questions are, how deep into the tissue can laser penetrate? There was a very good diagram that I was looking at on the website that there's two different types of wavelengths. There's a 900 nanometer and a 600 nanometer, and they penetrate from superficially all the way down deep, up to 5 inches deep into the body. So it can get quite down into the joint, as well as heal the soft tissues that are on the skin or just underneath the skin. So that's fantastic for healing of injuries and scar tissue, that type of thing. And there's different wavelengths and different pulses to the light that I won't get into here. It helps with conditions like rheumatoid arthritis, because rheumatoid arthritis is an autoimmune disorder that attacks the joints, causing swelling and tissue damage. Rheumatoid arthritis is different than non-inflammatory problems of the joint, and it's often mistaken for osteoarthritis or OA, which is inflammation caused by wear and tear of the joint. So we do see more osteoarthritis in the clinic than rheumatoid arthritis. But the cool laser therapy works by reducing the pain and inflammation caused by rheumatoid arthritis. The initial treatment schedule can vary depending on the severity of the condition and the length of onset, though the average patient receives 2 to 3 treatments per week for a total of 10 to 25 treatments over a 4 to 8 week period to heal the tissues. Since rheumatoid arthritis is an autoimmune disorder and it's not curable, in order to maintain a quality of life, a patient is placed on a maintenance program of 1 to 2 treatments a month thereafter to maintain pain reduction, inflammation, and increase range of motion. So that's wonderful too for people that have autoimmune disorders, inflammatory conditions like rheumatoid arthritis. So that's right from Theralase. And there was a really good diagram. Let's see if I can find it. I think it was back here. Let me see if I can get back to where that diagram was of the Theralase and the application of it. Let's see right here if I can find that. Oh yeah, right here. Here it is. So this is showing the different conditions that laser can treat, but it's also showing how the wavelengths work. The 905 nanometer wavelength, the pulsed 905 or the super pulse they call it, into the tissue, and then and that's at 660 nanometers right there. And then it goes to this level, which is about 2 inches with 660, and then up to 5 inches with 905. And then the strength of the pulse, the energy, the light going into the tissue. So very interesting how it works. Now, if you want to join me for the laser webinar, it's free, but space is limited, and there's only a few tickets left right now. So if you go to eventbrite.ca right here, or if you're watching live here on Instagram, click the link in the bio and you'll see our upcoming events. And then you're going to click reserve a spot. And by reserving a spot, you'll get emailed a link to the live webinar coming up this Thursday at 7 p.m. It's going to be about a half an hour webinar. And I'm going to talk about how laser works, how I've used it in the clinic, different conditions it helps with, and then how to take care of your body after a laser treatment. So we're going to talk about that. And then coming up after that in April, I'm going to be doing these webinars right here. So whiplash, orthotics and orthopedic shoes. I'll be talking about instrument chiropractic adjustments, both using the activator and the integrator instrument, and then how to choose the right chiropractor for your needs. So I'll be talking about all of those topics in April going into May 2nd. So if you're interested, go to eventbrite.ca, look for our clinic, Tut Street Family Chiropractic, Dr. Cary Yurkiw here in Kelowna, and then click reserve a spot. Now the last thing is, if you're looking for a chiropractor, we are accepting new patients. It's a very simple process. All you have to do is click on the Book Now button on our website, tutstreetfamilychiropractic.com. Book Now, you'll see the available appointments. Often we can see people the same or the next day, so that's wonderful. And then we are open 7 days a week. So lots of flexibility for appointments. We bill directly to insurance, including ICBC. We're up to over 25 different insurance companies now. The latest addition was Royal Bank, RBC Insurance, it's with Green Shields. So we're able to bill directly to them. We bill directly to Desjardins, Blue Cross, Medivie for RCMP and veterans. We bill to Canada Life, Manulife, Sun Life, so all of those insurance companies and many more. And then to ICBC for car accidents. So we bill directly to them as well. And you don't need a doctor referral. You can come and see us without a referral. We'll do the assessment. We'll talk about the diagnosis, and then we'll talk about different types of treatment in the clinic, including laser therapy, hands-on chiropractic, instrument chiropractic, shockwave, and even orthotics and orthopedic shoes. So I hope you can join me this coming Thursday. Please sign up or subscribe to my blog. Try to write a few times a week on the blog about what's going on in the clinic or the upcoming events. And if you have any questions, you can type them in the comments or you can DM me, whether you're on Instagram, Facebook, or TikTok, or on X. And then our longer form content goes on to YouTube and our podcast channels with Spotify and Apple iTunes. So thanks for joining me today. I hope you guys have a wonderful day, and I will talk to you soon.